myself Ranjitha, I'm nursing tutor in E.S College of Nursing. Now we will discuss about neonate CPR. First, what is the meaning of CPR means? CPR is the when the cardiac arrest is occur, the heart stop the pumping blood. The CPR can support the small amount of blood flow to the heart and the brain until the normal heart function is restored. That is the CPR. And next one is the pediatric CPR means pediatric basic life supports and pediatric advanced cardiovascular life support, then prolonged life support. Then next one basic life supports. The most important intervention is airway breathing and circulation. Then what are the types means it have a two types. One rescue or two rescue can use it for the infant or childs. Then next one is the pediatric chain for the survival. First one prevention, yearly cardiopulmonary resuscitation and promote the access to the emergency response system and rapid pediatric advanced life support and integrated post-cardiac arrest care. Then next one is the what are the steps we have followed for the CPR means first one is the secure the scenes. Secure the scenes means nothing but this means pulling the victim out of the standing for the dangerous situation like water, traffic and other dangerous situation. That is the secure of scenes. Then next step is the check for the responsiveness. It means if the victim is unresponsiveness, tap the victim for our shoulder if they can show any response means. Then next to go for the unresponsiveness patients means start for the for longer than 10 seconds, wait for the 10 seconds and check for the pulse at the carotid and the femoral artery. A heart rate for less than 6 beats per minute is considered as a cardiac arrest in the children's and the infants. If there is a pulse and the breathing is continue to monitor and support the breathing. If there is a pulse and no abnormal breathing means it start the rescue breathing every 2 to 3 seconds. If there is no pulse and no abnormal breathing means start the high quality of CPR. High quality of CPR means compress to at least 1/3 of the anterior posterior diameter about the 2 inches. We will compress the chest at least 2 inches. Then allow the chest to fully recoil. Wait for the recoiling time. Then continue the CPR 2 minutes or until the aid is powered up or ready for the uses. Then the single rescue means they can give the 30 compression and to breathe. That means 100 to 120 compression per minute. In case of 2 rescue means 50 compression and to breathe. That means 100 to 120 compression per minute. The next if help is not available, leave the child to get the help and aid. Then next go for check the heart rhythm using the aids and following the instruction from the aid and deliver the shock as needed. Then next one BLS sequence for the healthcare provider assess the need for the CPR. What are the CPR provider assess for need for the sequence of scenes is first one is the unresponsiveness and if absence of breathing and gasping and send someone to active the emergency response system. Then first one is the recover the position. Then next for the check for the pulse, the brachial if an infant and carotid or femoral in child. The infant means check for the brachial and child means check for the carotid or femoral pulse. If inadequate breathing with the pulse, the palpable pulse means greater than 60 per minute but inadequate breathing means rescue the breath 12 to 20 breath per minute. In case of one breath and every 2 to 5 seconds until the spontaneous breathing is resumes. The reassess the pulse every 2 minutes for the BLS. Next, the bradycardia with the poor perfusion means the pulse is less than 60. There is a sign for poor perfusion. For example, pallor, mottling and cyanosis and despite and support the oxygenation and ventilation and chest compression also. Then next one is the chest compression means the lone healthcare provider to use the 2 fingers and chest compression technique for the infants. In case of infants, they can use for the 2-finger methods. Then 2-thumb encircling hands techniques and recommended when the CPR is provided by the 2 secure. The next one is the circle the infant chest with the both hands and separate your fingers around the thorax and the place your thumbs together over the lower third of the sternum. Then give the compression of the sternum. Next one, in older children means give the compression in lower half of the sternum at least 1/3 of the anteroposterior dimension of the chest or approximately 5 centimeter with the heel of our 1 or 2 hands. This is the 2-finger chest compression techniques in infants for the one rescue. Then next one is the coordinate chest compression and ventilation alone in secure. The compression to ventilation in ratio is 30:2 for to rescue for the infant and children's. The CPR one provider should perform the chest compression while the other keeps the airway open, the performs and ventilation and ratio for 50:2. Then next one, deliver the ventilation with the minimal interruption in the chest compression. If an advanced airway is in place, the compression is rescuer should deliver at least 100 compression per minute continuously without pause or ventilation. The ventilation is rescue deliver 8 to 10 breath per minute. The breather 6 to 8 seconds. In case of using the defibrillation means what are the steps we can follow? Means the children with the sudden weakness of collapsed, they can likely to have a ventricular fibrillation or pulses, ventricular tachycardia and need immediate CPR and rapid defibrillation. In ventricular fibrillation and pulses or ventricular tachycardia are referred to as shockable rhythm because they respond to the electric shock. And next one is the children with then ventricular fibrillation means the initial dosage of 2 joule per kg can deliver. In refractory, increase the dosage to 4 joule per kg. According to the weight, they can increase 2 kgs and 4 kgs for the in case of ventricular fibrillation and initial dose they can give for the 2 joules per kg. Then in refractory means the dosage will be give 4 joules per kg and sequence of energy levels should be at least 4 joule per kg. The aid can differentiate the shockable from the non-shockable rhythms. Then hands compression. In case of hand compression means the optimal CPR in infants and children includes both the compression and ventilation, but compression alone for the performer to one CPR. Then next one is the mask ventilation. Next we will discuss about the bag mask ventilation. Bag mask ventilation means selection the correct mask size to the infant or newborn, then open the airway and making a tight seal between the mask and face, delivering the effective ventilation, assessing the effectiveness of ventilation. This is the face mask placing the babies. The EC clamp. EC clamp means techniques we have used for the back mask ventilations. 3 fingers of one hand left the jaw. They form the E shape. Then while the thumb and index finger hold the mask to the face, making a C shaped. This is a ENC clamp technique, bag mask ventilation. The next one is the cell inflating bag with a volume 450 to 500 ml of infants and the young children and 1000 ml in older children. For the adolescent, the ventilation, the oxygenation should be delivered. The supplementary oxygenation is attached with the oxygen inflow of 10 liter per minute. The concentration of delivered oxygen is variation from the 30% to 80%. To deliver the high oxygen concentration 60 to 95%, attach an oxygen reservoir to the self-inflating bag. The maintain an oxygen flow of 10 to 50 liter per minute. Then the tie seal between the mask and the victim face. Then next one, open the airway by lifting the jaw toward the mask and making a tight seals secures the bag until the chest is rises. Then next one, the bag and mask ventilation is not recommended for a alone rescuer. Mouth to the barrier device is the ventilation. The next one is the avoid excessive ventilation. Then give the each breathe slowly over the approximately 1 second. In 1 second they can deliver for the breathe in slowly. If the chest does not raise, reopen the airway, verify the tie seal between the mask and the face, and reattempt the ventilation. In case of the chest is not raised for the airway means you should reseal the bag, then put into properly, then give for the breathing. Then next one is the 2% bag mask. 2% with the bag mask ventilation means the significant airway obstruction. In case of significant airway obstruction and poor lung compliance, difficulty in creating a tight seal between the mask and the face. Then gastric inflation and cricoid pressure means to minimize the gastric inflation and deliver each breath over the approximately 1 seconds, and cricoid the pressure may be considered in a unresponsive victim if there is an additional healthcare provider. And next one is the neonatal resuscitation. Neonatal resuscitation means the etiology is asphyxia, and the following steps is airway breathing and circulation. A sequence has been retained unless is known as the cardiac etiology. The best indicator can need for the resuscitation, heart rate and respiration and the tones. The pulse across approximately need for supplementary oxygenation. The next one is the for term babies and behind the resuscitation with the room air in supplementary oxygenation is regulated by the oximetry. And the next step is no evidence to support the airway suction in active babies even in the presence of meconium. The next one is the 3 recommended compression is ventilation. Ratio is 3:1. If the arrest is known to be cardiac etiology, the higher ratio is 50:2 can be considered. And dosage is epinephrine dose of 0.01 to 0.03 milligram per kg IV can be provided, and endotracheal route 0.05 milligram per kg to 0.1 milligram per kg can be provided. In newborn who require the CPR in other settings, for example, pre-hospital aid and pediatric intensive care unit should receive the CPR according to the infant guidelines. Then next step is to rescue, provide the continuous chest compression with the A chromosomes and ventilations if an advanced airway is in places. The ratio is 50:2 ventilation to compression ratio of a no advanced airway is in place. Then next one is the post resuscitation care and post cardiac arrest care. That means the therapeutic hypothermia is recommended for the evolving the moderate to severe hypoxic ischemic encephalopathy. Then next one is the duration of resuscitation for newborn with a prolonged cardiac arrest in a newly born baby with a no detectable heart rate that remains undetectable for the 10 minutes. It is approximately to consider the stopping the resuscitation. Thank you.